In this clip, I'm going to answer the question, what is allergy? Allergy arises when the immune system overreacts and mistakenly fights off something that we wouldn't normally bother about. This may be something we ingest, such as a food, something we inhale, like pollens or dusts, or something that gets through the skin, such as substances in creams and lotions, for example. In a normal person, the immune system wouldn't worry about these things, but in the allergic person, it mistakenly overreacts to fight the substance off. The tendency for this to happen is largely inherited, so someone who has allergic parents or allergic brothers and sisters is far more likely to develop allergy than someone who hasn't. When the immune system overreacts in this way, it makes antibodies. Normally we call the allergic antibody IgE, immunoglobulin E. Once the immune system has made this antibody against a specific substance, it attaches to the surface of cells in the body known as mast cells. Mast cells are found in all the lining surfaces of the body, such as the skin, the respiratory tract, the lining of the eyes, and the lining of the gut. Once we've made the antibodies and become allergic, the next time we meet the trigger substance, the allergen, that reacts with the antibody and causes the mast cell to burst and release chemicals into the surrounding tissues. The main chemical released from mast cells is histamine, and histamine produces certain effects in the tissues where it's released. It causes irritation, vasodilation, which is blood vessels expanding, and leakiness, increased permeability of the tissues and tissue membranes. And it's this release of histamine into the tissues which causes the symptoms in allergy. For example, if you have grass pollen antibody on mast cells in the nasal passages, then when you next meet grass pollen and those mast cells burst, histamine released into the nasal passages causes sneezing, itching, and a runny nose. But if you have grass pollen antibody stuck on mast cells in the lining of the eyes, the conjunctiva, then histamine released there causes itchy eyes, red eyes, and watery eyes. In the lower airways, the release of histamine causes the airways to narrow, which makes you wheeze and makes it more difficult to breathe, and it causes an increase in mucus production and fluid into the airways, which makes you cough to try and get rid of the fluid and the mucus, so that produces the symptoms of asthma. Histamine is released quite rapidly and it works quite rapidly, so the allergy symptoms from the release of histamine occur quickly on contact with the trigger, but they also settle down after an hour or two. There are other chemicals released when mast cells burst, which produce a more delayed reaction, an inflammatory reaction, which starts after an hour or two but goes on for many hours, and that produces the later symptoms of allergy. Most people who have allergy find that their symptoms consist of these two phases: an immediate response from histamine release and a more delayed inflammatory response. And that can sometimes make it more difficult to identify what the trigger factors are. So far, I've talked about IgE-mediated allergy caused when the immune system makes antibodies to fight things off. But some allergic reactions have a different cause. Cells in the immune system can themselves become sensitive to substances. A good example of this is contact allergic dermatitis. So, for example, nickel allergy. When nickel comes into contact with the skin, cells in the skin that have become themselves allergic to nickel set up an inflammatory reaction. In this way, the immune system can sometimes cause allergic reactions even when antibodies are not involved.